All right, our last topic for today. We've been working hard all day. All right, so this is definitely one video on this topic is probably not enough, but we do want a little bit of a discussion about healthcare. Right now, this is the middle of November, actually, yeah, the middle of November, and we've just gotten through the shutdown, and now we know that people are not going to have affordable health care possibly after the first of the year because their prices are going to go up significantly with the ACA. So, and I don't like politics, but I'm a doctor, and this affects us a lot because of our patients needing health care. So one of the things, of course, that I've been doing now for the last 7 or 8 years is direct primary care. And we have a whole web page about direct primary care, so I won't go into exactly what it is, but it's definitely, hopefully, going to help people. I will talk about cost because that's a big issue that people may not understand that direct primary care provides. The lower cost health care, it's not free, but it's definitely an option for people, and we want people to know that there are options out there. So direct primary care is basically a membership type program. It's not concierge medicine, which is way more expensive, but it's $60 a month, and I'm probably the least expensive in the country. There may be a couple others that do it for $60. Some are a little bit more than that. But it's $60 a month to see me. They mostly see an MD every time. Sometimes they can get the nurse practitioner if I'm not there. But we can do hour-long visits, which I do almost every single day. Probably every day. I do at least 2 or 3 hour-long visits. We do half-hour visits for sure, never less than that. So the other benefits to being in direct primary care in our clinic is our labs are very, very inexpensive. So one lab, just as a for instance, we have somebody who went and got a thyroid test at LabCorp, and they were going to charge her $95. Because she was cash, they marked it down to $55. And this was years ago, 8 years ago? It was a long time back. And in our lab, and it's always been this price for the last 8 years, it's been $5. And it's still $5 to get a thyroid test, a TSH. So that's a huge benefit to people. And we have several labs that we can do. They're actually cheaper now than they were a year and a half ago. They've come down just a little bit. So we used to do, I think it was 4 different labs, a comprehensive metabolic panel, a CBC, a hemoglobin A1C, and a lipid, and it was $18, and now I think it's $14. So for all 4 of those, which is incredibly low. So that in and of itself can be a benefit to a lot of people, even some people who have health insurance. The other benefit to our clinic is we have medications that are it's oftentimes 1/10 the price of a cash price at the pharmacy or a regular price at the pharmacy. So prices will go up and down a little bit, but like a Z-Pak, for instance, is an antibiotic. And it will be anywhere from $15 to $25 at the pharmacy, cash price. And we've had it as low as $1.67, $1.89. Right now, I think it's $2.50, so around that ballpark. So there's medications often that we can get much, much lower. Now, they are generic, but most of the pharmacy medicines are generic as well. So that really, really helps people. The price of medicines. We also can get labs for a whole lot. I mean, x-rays, MRIs, and CT scans, ultrasounds, much cheaper often than the hospital. Not quite that much cheaper, but we definitely can get those at a lower cost. So those are things that we try to do to help people. And then we also try to keep people out of the ER, and we try to keep people, we still sometimes have to send them to a specialist, but we work really hard to get them the services they need. I feel like sometimes we're social workers, but that's, if we're able to get them help, that's what we try to do. So the one thing that I think that one goal that I've had in my practice, or as a physician overall in the years I've been in medicine, is to try to help make healthcare better for everybody. And part of that is having a better relationship with our patients. The problem with that is it's really hard for any doctor to be able to do that because they don't have time. And I always try to tell people, because I can do an hour-long visit doesn't mean every doctor can. They cannot do that. We can't operate that way in a regular clinic. So half an hour is the best we can do, probably. And occasionally we might spend more time with people, but then somebody else will get a really short visit if they're sick. So it's very, very difficult to build relationships when you don't get to spend a lot of time with people. I get a little frustrated because lawyers can get paid huge amounts and spend an hour. They spend an hour with us, get to know all about us, and so can psychologists and lots of other types of practitioners. But a doctor who really matters, I feel like, can't even spend more than 20 to 30 minutes ever with a patient. And sometimes their health issues are really involved, and we really need a lot more time. And I get really frustrated now because the insurance companies just this year are cutting us. If we code up because we spent time with people, they're cutting us back. They don't care. They're like, sorry, we're not going to pay a level 5 visit. You're only going to get a level 3 or a level 4. And we even do our documentation and everything when we spend time with people. And nope, we're not paying it. And so, that's very, very frustrating. And it's all about money, which is very, very difficult. So, so that's really, how do we do this? How do we have better relationships with patients when we don't have the time? And I think that's why I really like the model of direct primary care. The issue with direct primary care is that people do have to pay cash and they have to pay money. And what does that mean? Do you get people with insurance, without insurance? We actually get people in all, ranges. We have business owners who can't afford, the huge dollars of health insurance for their families. They love it. They absolutely love it because the cost is so much lower. But how I try to think about the big picture. How can we help healthcare all the way around? Not just direct primary care, but all healthcare. How can we help bring the cost down for the regular person? And it's a difficult problem. So that's something I think about a lot. And even as I move eventually into slowing down and doing less clinic care over the next 10 or 15 years, because I'm going to be getting a lot older, it's still something I want to be very involved in to see if we can't really help get people better health care, more time with their doctors, better relationships, and then working with patients and being more patient-centered, which means patients do have to take responsibility for their health care, but then we have time to teach, give them tools and things they need. I know that you are direct primary care, Ms. Bree, so can I ask you some questions about why you do it?
Sure. We got a camera.
We'll trade spots. All right, I got to move the camera because I'm short and you're tall. All right. Okay. So that's good. So why do you want to do DPC? You've been in DPC now from the beginning, I'm thinking.
Since you started.
Yep.
I am a mom. I have 3 kids. I didn't always have insurance. I have insurance now through my husband's workplace. I work for you, but
Yes.
because you're a small business, that's not an option. But I think one of my favorite things is, aside from having an hour with you, the accessibility. Like when someone becomes your DPC patient, you give them your cell phone number. And so I'm able to text you if my son falls down and has a bump, or, you know, somebody has a fever or something's going on and I'm worried. If it's like 8 o'clock on a Saturday night, we don't have to just go, all of us, to the emergency room to make sure that my kids are okay. I can text you with a worry or a concern, and you usually get back to people very quickly. And that has kept us out of urgent care. It's, you know, helped me to know this is what I need to do for the kids. This is not anything to worry about, or, oh, hey, maybe this is a concern. This is what we do. So as a mom, that's really helpful. I know for myself, being able to talk to you, when you talk to patients, you go more in depth, like you find out about stress levels and what their workplace environment is like, and if they're around chemicals, or, you know, what kind of food do you eat, what things do you struggle with, what your diet is, like what your, I don't know, family relationships are,
Mm-hmm.
because all of these things tie into health. It's not just, you know, results on a lab sheet. You're able to find out more about the things that really influence people's health, I guess, on a deeper level. And so I appreciate having that time, like both for myself and for my kids. And affordability is a big thing. There's been times when, if we would use the insurance, the copay or the cost of the labs would be really high. I think one time there was like I don't know, a swab to find out just kind of colds and flus and just a general, you know, respiratory panel. And I think through the insurance, it was very expensive. But if we charge it through DPC, it's a lot more affordable. And saving money on prescriptions, being able to have a phone consult with you if I can't, you know, round all 3 of my hooligans up and drag them to the clinic because we're about 30 minutes away. Being able to talk to you on the phone. I think another big plus for me is how quickly we get seen. We're in the same day or the next day, or most certainly that week, but definitely if there's something urgent, you know, there's been a few emergencies when my kids were little and we were in that day. And that's really helpful because I know some people struggle getting seen, you know, in a month. If there's some sort of maybe chronic condition that's going on.
Yeah, I think I enjoy being able to see somebody, and I'll even ask them to come every week, especially if they've got diabetes and they're out of control. Blood pressure, we just keep seeing them. We see them several times in a month, and then we might go a whole month without seeing them. But that way we're able to really follow, really work on things, figure out, you know, what's causing it, you know. So I definitely, and I know that we don't do that as much in the regular clinic. You know, we might see them a week later, but then we might see them another month later and then 2 months later. So definitely being able to see somebody often and frequently is been very helpful for me to get to the root cause of what's going on with them.
I think another good thing too, from the perspective of my children, is because it's always you that we see, and you know, your staff is so great and it's always the same people in the same places. It's a lot easier for my kids to feel comfortable and safe. They can tell you, you know, if something's going on, or if there has to be, you know, a blood draw or whatever. They're not as scared about it because they've seen you and the awesome ladies that work at your clinic for, you know, their whole lives. So it's not new and scary. And I think that consistent quality of care really helps. because going to the doctor, even for a grown-up, is a scary experience anyway, especially if you're not feeling good. So having people who know you and your family, I think, really helps take some of that anxiety and fear away from going into a doctor's appointment.
Yeah. All right. So maybe through all these things over time, we can really help. I'm not quite sure how, but maybe we can work towards getting better health care for everybody somehow by using this method. So maybe we can have some other form of it or some way to do care for people where you don't have to be in a rush and you can get in quickly, and you can really get some decent care, and hopefully learn to overcome some of the chronic disease, which is what's killing us, is all this chronic disease with diabetes and autoimmune disorders and things like that. Well, thank you so much for coming today, and you've helped all day with videos, so we'll hopefully get a lot of these online soon, over the next 2 or 3 months, and we're going to hopefully keep doing some good videos, better videos as we go, when I have a little help and I'm not doing them by myself and just sticking a camera up in my face. So hopefully this will be great, and thank you so much.
And if anybody has things that they want answered, questions they want answered, or video topics, anything from the realm of food, farming, and medicine, those are our areas. So just let us know in the comments or through the website agrosharemd.com.
Thank you.